Royal family in hospital. Now, we've already discussed this briefly, but I want to come back to this. For a start, why the royals felt the need to be so open about health problems. Kate, the Princess of Wales, already had abdominal surgery. She's going to be in hospital for 2 weeks, not carrying out public duties until after Easter. Suggests some pretty serious surgery there. We wish her well. You know, a young, healthy woman, mother of 3 children. We certainly wish her well. Hope everything has been successful. But we also know, this was announced the same day from the palace, that the King, King Charles, a man of a certain age, in his 70s, that he is going into hospital to have a routine procedure on an enlarged prostate. There's a bit of a discomfort about having this information. You know, this sort of thing Prince Philip would have been horrified by, this level of personal information. Do you think they had to give that information out? Otherwise, you know, the social media world will have taken off?
I think it's a reflection of society. You know, society clamours after the level of detail where I think it's wrong for it to come out. Let people have personal lives, and medical conditions are very personal. Now, I think with His Majesty, it may be slightly different. You know, by him declaring this, he's actually making something that is very difficult for men to talk about. And
I mean, you are all useless about going to the doctor.
Well, exactly, and there's no routine screening for prostate issues. So he's bringing that to the fore, and that, I think, can only be a good thing, in the same way that you know, the young royals were talking about mental health issues over a period of time. So there is some good coming.
I wish them both well. And again, I feel sorry that they have to have their personal health matters in the public eye. Their choice to do it, not mine. But I also have an issue, I'm sorry, I do, with them using private hospitals. I mean, everyone's entitled, in a free country, everyone's entitled to have private health care who can afford it, because that's not most people. 7.5 million people on waiting lists. Most people in this country don't have a chance in hell of affording any sort of treatment whatsoever privately. Even a couple of £100 to see, you know, bump up yourself in the consultant list, you know, to go and get an appointment, you know, often weeks or even months or even years ahead of other people. Not even an option for many families. They're going to, you know, they have their babies in private hospitals, and they have all their treatment in private hospitals. And lots of people say, well, they're the King and the Princess of Wales, of course they should. But they clap for the NHS. They go and open wings. They support the NHS massively. But when it comes push to shove, they don't think the NHS is good enough for them. If Rishi Sunak or Keir Starmer went into hospital for a minor or a major operation right now, today, and it was a private hospital, all hell would break loose, even though both of those men, I'm sure, can afford private health care. But why is it not OK for politicians to do it, but it is OK for the royals to do it?
Well, the politicians, there's a political direct control bit with the funding. But I think, actually, you know, there's one less person on the waiting list, and the level of disruption that it would cause because of the paparazzi that would be out around the place, trying to do everything to get onto the wards.
You can't do that anymore. Look, I was a news reporter at the time when you were allowed to walk into hospitals and interview patients. You cannot do that anymore. You are going to be
blocking the doors,
trouble.
Blocking the ambulance routes. You're trying to do everything, the security that would have to go in that would disrupt normal
activities. You think it's about security disruption?
I think that's part of it.
The argument on the private healthcare, the idea that people you're not adding to the NHS list. It's the same most of the time. It's the same doctors and nurses who are just doing extra work in the fields. And the amount of times, if you go to a doctor in the NHS, you say, "Well, how soon do you think I can get that operation?" Well, on the NHS, it will be 2 months. But I can see you next Wednesday if you come through my Harley Street office. It's the same people. If people didn't, I've not got a problem with people having private healthcare. Okay, I'm just saying. I just think we should not be hypocritical about it when wealthy people use it, and people who will lots of people. I know people who have remortgaged their homes to pay for an operation because their family member has waited so long, pretended they're doing some home improvements or something. People are desperate right now, and look, I'm really glad they've got the health treatment they want and they need. But you know what? There'll be an awful lot of people who also need health treatment who aren't getting it, and no one seems to care about that.
There are, but I think that's a different issue. And I think there needs to be a complete redesign of healthcare. I don't understand how you can have 3 hospitals all getting the same sort of funding from the same sort of politicians. One of them has got massive waiting lists. The next one has got medium-level waiting lists. The next one will see you tomorrow. And they're all NHS hospitals. Is that a government policy issue, or is that a management issue?
Yeah, NHS management needs
I think there's a bigger issue with management and bureaucracy in the NHS than there is with government policy and funding. We need to deal with that. And that's what's causing most of the problem.
But also, again, people being able to have the right to choose. A lot of people don't realise they can, and they'll trust what they're told and not realise you have other options. But I just wanted to raise that. I'd love to hear your thoughts on this.